Welcome, everyone. We're delighted to have you. This is the fourth panel of the older persons track at WSIS on aging and tech. Our panel today, the healthy aging ecosystem, how digital solutions are expanding access to care, improving care delivery, and empowering individuals. We are delighted, the Global Coalition on Aging, to be the partner with WSIS and to be partnering explicitly on this older persons track this week. As I said, this is our fourth of 4 days of panels, and there are 3 panels by the World Health Organization as well. So we're all also celebrating the decade of healthy aging. Let's now go to the video, the WSIS video, and then we'll come back to our panel. Thank you very much. Welcome back, everyone, to our panel, the healthy aging ecosystem, and how we're enabling technology for better caregiving, healthier aging for all. We welcome our panelists now. I would simply set the stage for what we are very excited and enthusiastic of a very good panel to remind us that we now are in the second year of the decade of healthy aging. The WHO decade, World Health Organization decade, and the United Nations proclamation. It joins the Sustainable Development Goals to try to bring the world together, leveraging this mega trend of global aging. 1 billion of us on the planet over 60, growing to 2 billion, doubling in size in the next couple decades. Even more profoundly, more old and young in every society as it modernizes. And therefore, the needs for the healthy aging ecosystem, which can not only enable healthier aging for all, but will also be essential for fiscal sustainability, and even economic growth. So we're going to have a very exciting panel today. We will now go to each of our panelists. We invite all of the participants to engage with us through the Q&A and/or the chat function, asking questions, putting comments on, and we hope to integrate you into this hour discussion. Let me now turn to Dr. Yuka Sumi, Medical Officer, Aging and Health, Department of Maternal, Newborn, Child, and Adolescent Health and Aging at the World Health Organization. Yuka, we're truly delighted to have you here. We know you are leading the ICOPE, a very important program, which is, of course, one of the cornerstones of the decade of healthy aging. Integrated care is one of the centers, one of the pillars, along with age-friendly communities, combating ageism, and reform on long-term care. But for this ICOPE, we'd like to ask you, Yuka, to tell us a little bit about ICOPE, how it is, you just launched about a week ago, and I was delighted to be able to observe that. And where some of the disease areas, from Alzheimer's and oncology to osteoporosis, bone health, vision, are engaged, and how you see that enabling a healthier aging.
Thank you so much for your kind introduction, and hello everyone. It's really my pleasure to be here. You know, we talked about, he touched on this is the second year of a decade of healthy aging, but this is actually third year of the COVID-19 pandemic. And COVID-19 pandemic has revealed the vulnerability and the inequality of health and long-term care system for older people. Due to lockdowns and social or physical distancing, older people were told to stay at home and then to be distant from the people. At the same time, there has been a dramatic shift towards telehealth and telemedicine, and the use of the technology has become stronger asset in identifying the care needs and providing care. Since 2017, WHO promotes integrated care for older people, ICOPE approach that reflects and continuum care to reorient health and social services towards a more person-centered and coordinated care. When we age, our intrinsic capacity, which is physical and mental capacities, tends to decline. Although the speed of declining is very different by individuals. For example, at age of 85, who enjoy the climbing mountains every weekend, to the at age of 60, who needs assistance from others in everyday life. However, there are evidence-based interventions available to prevent declining in the intrinsic capacity along the second half of life. The objective of the ICOPE approach is optimizing intrinsic capacity, which is physical and mental capacity, and functional ability, which is interaction of intrinsic capacity and environment for older people, and promote healthy aging. So first, understanding their values and preferences. So it's about person-centered care and conducting person-centered assessments that include intrinsic capacity, underlying diseases, and physical and social environment. Then develop a care plan together with older person, involving the multidisciplinary team and ensuring the referral and monitoring and care plan. Embarking on the decade of healthy aging, many stakeholders have started pilot implement ICOPE approach in their countries all over the world. We are learning from their experience as implementation is context specific and local co-design and adaptation is critical. The enablers of implementation includes capacity building of health and care workers, as well as use of technology to collect and share data and monitor them. WHO ICOPE handbook app in 8 languages, for example, support health and care workers screen and assess older people's intrinsic capacities, underlying diseases, social care needs, and develop a care plan. Recent pilot studies of ICOPE in China and France have adapted the digital approach, developing local context-specific mobile apps to support the screening step of the ICOPE approach. Telehealth approaches were also used to provide follow-up care and monitoring at individual level. Of over 1,000 older participants in the study in France, nearly 80% were satisfied with ICOPE digital tools, and more than 65% said they were useful. For the population level, high-level investment and commitment is happening to integrate ICOPE data, which is focusing on the capacities, into National Electronic Medical Record, which is more focusing on disease diagnosis and treatment. For example, in Qatar and France. It is a great asset for policymakers to identify the older population needs and allocate the resource wisely. Digital healthcare solution must consider local requirements, existing infrastructure conditions, the capacity of health and care workers, and the socio-economic constraint when designing for resource-poor settings. If these necessary adaptations are made, digital tools and approaches can act as a strong enabler of the delivery of integrated care for older people. And then proactive engagement of older people, their communities, their healthcare workers is critical for this process. Thank you very much for your attention.
Thank you, Dr. Suma. It's really a great introduction and makes it very clear how the transformation of our health ecosystem is critical in a context of our longevity now in our 21st century, and the role that ICOPE can play, whether it's in areas like osteoporosis or Alzheimer's, vision health, enabling mobility. And a key point that you made, which I know others will refer to, is that now with healthy aging in scope, we perhaps think of success metrics in the context of functional ability. So we'd all like to have the absence of disease, but we know that's a very difficult challenge. But if we can achieve functional ability and have a healthier aging, that can be a huge benefit. And we know ICOPE is playing a great role there, and including in many of the countries you mentioned. And one of those countries, of course, is Japan. Japan is well known to many of us as super aging society. Again, not only many older people, but also the proportion of old to young is already at the leading edge. And so Dr. Hidenori Arai, I know you've done a lot of work, including with ICOPE, and Yuka Sumi referred to some of that, but now I'd like to turn it over to you, Dr. Arai, to give us a sense of how you've been operating in this space. I know you have some slides, so go ahead, Dr. Arai.
Thank you, Mike, for your kind introduction. My name is Hidenori Arai, the president of the National Center for Geriatrics and Gerontology. Sorry about that. I tried to start it again. So as you know, Japan is the most aged country in the world, and we have a lot of healthcare problems in Japan, in addition to insurance capacity and all those things. Oh, sorry, again. So the first thing I'd like to mention about the achievement or outcomes which was done in collaboration with a global coalition on aging is shown here. I hope you can see the slides.
Yes, so perfect. Thank you.
Osteoporosis and fragility fracture is a huge burden in most of the country. Of course, Japan is no exception, and we need a lot of healthcare resources to prevent fragility fractures, both for primary and secondary prevention. And Japan, actually, we have every 2 years we have medical fee revisions. As you know, we need a lot of cost for the prevention of fragility fracture. So multidisciplinary team approach is necessary. But because of the cost, most of the hospital try to avoid such effort because there's no incentive. That's why we try to ask the government to put some incentive for that kind of approach. And this slide is the biggest achievement from this April. And actually now the government puts some incentive for early surgery fee for after hip fracture, and also if we have a multidisciplinary team approach based on fracture liaison service guideline and also other guidelines in the acute and subacute and outpatient settings. They gave us some incentive for the management of fragile to fracture patients, which is a very big and exciting achievement in Japan. And once again, this was done by the collaboration with international advisories such as Global Coalition on Aging. In terms of the healthy aging ecosystem in Japan, as Yuka mentioned, ICOPE and ICOPE handbook were translated into Japanese already. And we are working on adding Japanese to ICOPE app, which is in progress now. And right now, there are so many wearable devices and other technology to monitor daily life, such as sleep, nutrition, and physical activity. So we'll try to use ICOPE app and other app to predict outcomes in the near future. And also we are developing some coaching app for lifestyle modification and medical consultation. In collaboration with Ian Phillip, who will give a talk later, and we're trying to use the Japanese version of ICT assessment tool and introduce this tool to fragility fracture prevention, both for secondary and primary prevention. We are also developing Kayoinoba app by our center. Kayoinoba is a place where older people can interact with their neighbors and for the activity focusing on resident-centered fragility of frailty prevention through physical exercise, hobbies, and other activities. I'm sorry, most of the words are in Japanese, and this is the content. The older person can monitor their life, physical activity, and they can check the health status. And there's some exercise movies, and there is a communication tool, and also brain training games. And they can this app can create automatically working courses for daily life. Thank you. That's all for my presentation.
Thank you, Dr. Arai. And as everyone saw in the chat, Dr. Arai is president of the National Center for Geriatrics and Gerontology and Japan Gerontology Society, and has been a leader. And related to Dr. Sumi's earlier comments, of course, ICOPE is beginning to take on a reality, the International Care for Older Persons in Japan itself, not only in the written word, but also in the technology applications. So thank you, Dr. Arai, we really appreciate it. And now I'd like to introduce Dr. Ian Phillip, who was already referred to by Dr. Arai. Dr. Phillip, founder of Age Care Technologies, but also a very enthusiastic background in older persons. I know, Ian, you've been at the UK, the United Kingdom National Health Service many years ago, and have been involved in many countries around the world with the predecessor to Age Care Technologies, your Easy Care Foundation work. Ian, if you could explain to us how you're working with ICOPE, how you're thinking about this for a variety of diseases, and where it relates to a healthy aging for all of us.
Well, thank you, Mike. It's a great privilege to join the panel. First, I'd like to pay tribute to Yuka. Under your leadership, Yuka, you've moved ICOPE from an embryo to now a well-developing child, which is attracting a huge amount of interest from around the world, and so many projects that are taking the philosophy of person-centered care and using practical tools to translate that into what is really health system transformation, which will help achieve the UN goals of building older people's functional ability so that they are able to do the things which give their lives meaning. It's such an important mission. And my own involvement in this work goes back really 33 years to when I started to develop methods to promote person-centered, preventive and joined up integrated care for older people that Mike referred to the work of the Easy Care Foundation. And I've now set up a social enterprise, business aged care technologies, which uses the social enterprise model to try and encourage uptake at scale. And we are really, again, very privileged to be supporting ICOPE first stage implementation work with plans for work in 20 countries. Some of that work is particularly focused in the area of fragility fracture prevention with an integrated bone health ICOPE approach, because if we can reduce the incidence of fragility fracture, that in itself can make a huge contribution to improving older people's functional ability and their lives. And a great privilege also to work with Dr. Arai in Japan on that project. We also have a focus with fragility fracture and work we're doing in Italy, planning to do in Belgium and in Pakistan. And this model, I think, of integrating the generic ICOPE approach, which should be the foundation for holistic preventive care for older people, with best practice in disease prevention, I believe should apply to other major conditions associated with aging or with older people, including Alzheimer's, oncology in old age, diabetes, cardiovascular diseases, and so on. And I think the future of healthcare will be globally. Healthcare transformation for aging populations will be grounded through the combination of the methods that are being developed relating to ICOPE and advances in the treatment and management of the major conditions of aging. Our own contribution is through the social enterprise model. We've been able to produce a digitized assessment tool, which is well validated and is supporting uptake of ICOPE methods at scale. And we were so pleased to win the inaugural WSIS prize for innovation to promote healthy aging because of the potential of using digital technologies to create benefit at scale. And our own contribution is setting the modest mission of getting the technology out to 100 million older people by 2030. That would be 1 in 14 of the population of older people globally by that date. So I think we're on a fantastic mission. So many people around the world are getting behind this. And I hope we can make ICOPE the pillar and digital technology the enabler of this transformation. Thank you.
Thank you, Ian. That's a great background, and we want to come back to that and learn a little bit more about how it's working and various countries that we have opportunities in. But at this point, I'd like to turn to Irina Calderon-Libal from the European Union. Irina, we're delighted to have you. Irina is the Policy Officer, Health Innovation Ecosystems, AI and Health, Active and Healthy Aging at the European Commission. And of course, you come to your role at a time when the EU itself is focused on healthy aging. For the first time, we have a commission on demography, and you're, I know, interacting with that commission quite a bit. But your role in technology is critical for healthy aging, and we'd love to hear some of your thinking and what you're doing across the EU and how we can all work together to enable a healthier aging, not only in the EU, but learning from what you're doing elsewhere. Irina.
Hi, Michael, thanks a lot for the invitation. And Yes, I could only add to what Ian also said. Digital technology is an enabler when it comes to promoting healthy aging. We at the European Commission, and in particular my unit, manage and promote various policies related to the digital transformation of health and care. And a very big strand has been on enabling healthy aging with digital technologies for now more than a decade. And we have promoted the research and development of various tools and technologies for particularly age-related conditions, whether it's frailty, whether related to dementia, but also on enabling age-friendly homes and environments and integrated care solutions in general for now over a decade. And also we really worked hard on sustaining a very active ecosystem because that is quite essential throughout all European regions, where innovators, but also end users and patients and practitioners, but also authorities together work on enabling the scale up and the adoption of those technologies, because we are still very far from a general use of technologies when it comes to enabling well-being and health and care in Europe. So we have been managing the European Innovation Partnership on Active and Healthy Aging since 2011. Within it, there have been various working groups working on specific challenges across various member states, but also there have been different activities. For example, one which has been extremely useful has been the Twinnings program, which is the exchange of best practices between various regions in the EU, where we support the adoption of a particular technology that has worked well elsewhere in a new region. And we have also had the Active and Assisted Living program co-funded with member states, where member states commit to support the development and adoption of particular technology in their region or even a community. It could also be very a local solution that works somewhere. But we still face a very big challenge on using these technologies. Mainly, of course, there is skills issues, digital skills issues among end users, but also among the health practitioners who are not always used to prescribe or to adopt new technologies. And of course, general issues related to health and care transformations, such as interoperability or trust or protection of data, etc. So those are all things that we are working quite hard on a general global level, but also on more local level. What has been a little bit of a change of mindset in the recent years has been we published a green paper on aging last year in January 21, which really promotes taking policies, lifelong policies on health promotion and prevention of diseases, and looking at aging as something which is makes part of our life, and we should really take necessarily steps to and empower citizens and patients to take care of themselves and use also technologies throughout their lives, but also another aspects on how to maybe change a mindset of these technologies are not really for aging, but more of treating a particular disease and a particular condition. So a little bit reduce a certain negative stigma that there is sometimes with aging on a condition and a disease, because people vary greatly when they age and in their health and physical health, but also mental health conditions. So how to really design those technologies to treat a particular disease and condition at any age in order to really promote also much more the uptake of these technologies. So quite a lot of challenges still ahead of us, but we are working a lot and indeed looking forward to cooperation also, because this is a global issue for all of us. Thank you.
Thank you, Irina, and congratulations to you and your colleagues in the EU for that green paper, which we all look at. We know there's digital health and digital technology generally in there, but it is about, as you say, the broader array of policies and opportunities across the European Union, where healthy aging is very central. As you say, you've been working on this for at least a decade, probably more. I'd like to now turn to Rich Carter from Eli Lilly. We're delighted that Lilly is a member of the Global Coalition on Aging. And Rich, it's great to have you here. Maybe you can tell us a little bit about, from your perspective, on the role of digital therapeutics in transforming biomedical innovation. This is something we're all hugely interested in. I know Lilly has great interest in a number of areas, including Alzheimer's, but diabetes and other areas as well. But that relationship between digital technology and biomedical innovation is something that the whole world is hoping for.
Yeah, thanks, Mike. And great to be here. Really excited to have this conversation, and just listening to the other panelists kind of give their introductions. There's a lot of common themes, so it was great to follow Irina and talk about this. So I lead digital health at Lilly, and we're really focused on driving improved outcomes for patients that use our medications, and we're trying to do that in two ways. The first is through connected clinical trials, and really thinking about how we leverage digital biomarkers within that field to really understand what's happening with our medicines, the efficacy, how they're helping a person, and trying to do that very quickly so we understand that data and insight to speed those medications to patients that need them. And on the second side of my world is really how do we use digital technologies and capabilities to drive improved outcomes through supporting our medications for our patients, and using digital innovation in order to do that. So if you think about those digital biomarkers that we're able to create on the left-hand side of my world in the clinical studies, if we understand those signals and how they actually relate to disease, we can then use those in the future for commercial solutions to support our medications and really help a person using our medicine to improve their overall outcome. We can measure how the therapy is working, what the person is doing. We can provide that back to their physician so they have real data that's valid, that they understand, that's relevant to the condition and the treatment of that individual, so that they can make better therapy decisions related to that. So we're really thinking about how we drive innovation through that, how we leverage some of those tools you mentioned, Mike, some of the digital therapeutics and digital biomarkers to really drive improved outcomes for patients using our medications. And as I listen to some of the other introductions, I think it's around how we treat a person irrespective of their age. It's how we help them move forward, manage their condition, use the tools and technologies that are available now to really generate better insight, to really help a person and help a person with their therapy journey. Thanks, Mike. Great.
Well, thank you, Rich. And I can hope that we'll get into a little bit of deeper discussion. Your role as Chief Digital Officer at Lilly is really very exciting, not least because it highlights the relationship in our 21st century now between digital technology and the biomedical world, which until recently were maybe a little bit more separate than now we see them coming together, and how they will spark innovation in a way that is very necessary for a healthy aging. So maybe we can come back to that a little bit. Now I'd like to turn to Sean Libren. Sean is, Sean Libren, Executive Director, International Healthcare Systems, Amgen Europe. Amgen, of course, is also a member of the Global Coalition on Aging. And Sean, we're delighted to have you. If you could, you've got some very interesting and exciting framing of how we connect healthy aging to technology. So I think we have the screen here, so go for it. And this will then bring us to some very explicit areas where we can come back around for a discussion. Dr. Sumi and Ian Philp and others, your comments on some of the slides that Sean is going to now show us. Go ahead, Sean.
Thank you, Mike, and thanks to my colleagues for the presentation. I'm definitely going to try to do you all the honour of mentioning something that each of you said through the presentation. So I thought today I would focus on an example for the integrated care for older people with respect to bone health. Now, I'm using the term bone health here specifically. A point that Yuka made at the beginning was to focus on person-centred and integrated care. The point here is that osteoporosis is a condition which may affect people over their life, but bone health should be important to everybody. And as we think about the future of the decade of healthy aging, and of course, as I age, I become increasingly interested in the impact and outcomes of people who are aging. It's becoming more important to all of us. So what I wanted to present here was a conceptual model of bone health, and I say not so. Yuka, once again, she had noted that context is local specific. And this, by and large, is the model that many countries may follow with respect to bone health. A person who's at risk of poor bone health is roughly around the age of 70, usually female. And at about that time of her life or his life, there's a healthy visit to the general practitioner. The bifurcation here between the green line versus the blue and the red is essentially the ability to spin off into a healthy aging pathway and maximize functional capacity versus the internal line, which actually is what happens in many countries with respect to poor bone health and osteoporosis. It may surprise people to know, even though we can walk down the street on a general week and see older people who are stooped and hunched because of the impact of osteoporosis, that 4 out of 5 people remain undiagnosed with osteoporosis. And often the first time they hear about that is after they have a fracture. But unfortunately, even after people have a fracture, they often are not told that they are at risk or have osteoporosis. So the inside path here represents often the journey where people start with a minor fracture, and that is a signal to the system at large that this person is coming back, because minor fracture begets a major fracture. And I talk about a major fracture with respect to a hip fracture in particular, which is often followed by a subsequent major fracture, which leads to quite a poor cascade of outcomes and death. It also may surprise people that roughly a person who has a hip fracture is 3.5 times more likely to die than their healthy age-matched peer in the next 12 months alone. So the important point about this diagram, and as it fits with integrated care for older people, you can see on the left I've taken an older shot, is the maximisation of functional ability. And all along this pathway, whether it be the green pathway for positive health outcomes or the internal pathway, there's opportunities for intervention to be able to target the ability to supply people with information. And that also occurs well before the age of 70 as well, is to assist people to understand and be aware of the implications of good bone health and the impact on their later life. So you can see around the outside here, I've indicated red dots, which are all opportunities for intervention. Both Ian and Irina and Rich have all mentioned the impact of technology and how that might influence people. I'd like to go further, actually, and add in the ability to supply data to individual physicians. Irina, you had noted that digital skills issues don't just occur with individuals, but also with physicians who may not be adopting to the use of information. The ability to use data to help predict and potentially prevent people's outcomes, as well as to supply information through this pathway, both in phase and out of phase, is certainly a rich opportunity for people with bone health, because we know literally and figuratively that the skeleton is the basis upon which certainly those people who are ambulatory will be able to live and grow throughout their aging lives. So I thought this was a nice example for us to have as a capstone at the end of the presentation and as we move to a discussion. Thanks very much, Mike and my colleagues.
Great, Sean. It is a terrific jumping off point. I now will encourage all of us to interact together and ask each other questions. But I will jump in by suggesting, Dr. Arai, I'm assuming that Sean's green lines are the ones we now have more capable in Japan as a result of these changes. So maybe you can comment on that. And then I see Yuka has her hand up, so then we'll move to Yuka. But go ahead, Dr. Arai, if you could comment on those green lines and what that pathway means.
Yes, thank you. Increase the number of older people who goes to green line is very important. But the question is how. There are several ways to find out high risk or frail older adult in the community by health examination or community screening. So, but it's a very big challenge for us to do screening high risk or frail older adult in the community. So actually, Japan has introduced the healthcare checkup since 2020 by introducing frailty screen for older people over 75 years old. But in the future, we are going to use ICOPE app or ICOPE program in the community for improving or increasing the intrinsic capacity of older people, which is quite challenging for us. But we need a lot of things to do to educate many healthcare professionals in terms of the implication of ICOPE in the community and also in the hospital. Thank you.
Thank you, Hidenori. Yuka, you raised your hand anyway, and now there's probably even more responding to Hidenori and how things are going in Japan. Please go ahead.
Yeah, listening to all the panelists' comments, there are so many things in my head, and I have 2 comments and 1 question, if I may. So 2 comments is about how important to work different levels or different stakeholders together. As Irina mentioned, how important having the policy for the prevention and promotion, because many clinicians, many researchers have already apps and approach for older people, but to be able to provide this good approach or integrated care for all older people in your country, really we have to work together from micro level in the clinician level, from service provider to the policymakers. that is critical, and that actually represent our decade of healthy aging, to bring all the stakeholders together towards healthy aging. Otherwise, it will not happen as a national scale up. And WHO is promoting universal health coverage. That means providing a service in high quality service to everyone without financial burden. And digital technology is definitely asset, but to facilitate this asset is actually to bringing all stakeholders, including policymakers, together. That is the first comment. And the second about ICOP approach, Sean showed that the graph for the public health framework. Although all the intervention is coming from more preventing frailty, more on the right side on the graph of the declining capacity, we really want to expand to the left side as well. So having a life course approach from the early stage as possible in the adult to how to prevent, how to promote intrinsic capacity, having healthier lifestyle, having exercise, having a good nutrition, having a good screening, so that all adults can have a stable and maintained capacity for the second half of life. These are the two comments. And then the question specifically to Irina, if possible. You mentioned the challenges around interoperability and protection of data, which we get a lot of questions to around the WHO app. So what is the first step to conquer these challenges, especially between countries? You know, when you cross the border, there's a different regulations and rules. So how we can actually make sure all the data is shared so that we can see the progress in terms of the decade of healthy aging. Thank you.
Well, thank you, Yuka. That was great comments, and the question will have Irina respond to that as you indicated, and then go to Ian. And after Ian, to prepare, I just want to make sure we get back to Rich from a Lilly or from really a biopharmaceutical point of view. If you can give us a little bit more visibility on not just how it enables once materials, digital or biomedicine therapeutics are in the market, but how digital is having an impact on the research itself that leads to innovation. But let's go to Irina on Yuka's question, then go to Ian, and then we'll come back to Rich.
Yeah, thanks a lot for the question. And also I wanted to refer to the comment on prevention. So in Europe, in let's say, general, the budget allocated to prevention from all the health budgets in member states is around 3%, which is absolutely nothing. So of course, that's a first start, how to really change this way of thinking and designing our health and care budgets, because it is still largely on treatment and less on well-being and health promotion and on prevention of more complex issues. But not only that, but I would come back also to skills, sorry. There is a huge gap, as I assume you all know, from high educated people to low educated people and their life expectancy. So in Europe, this varies, I believe, around 4 years of difference for women and 6 years for men. So the role that education plays in people's lives in maintaining healthy lifestyles and really living longer is enormous. So it really goes from the very beginning of our lives on how to lead those healthy lives. So, and now I come back to your question. Of course, we in Europe, we promote the exchange of health data through a common exchange format. So the HL7, so when it comes to really to the details, and to this has been already a recommendation since 2019 to start to exchange at least a health dossier, if not a whole European health record, at least the more basic information to be able to be exchanged throughout one member state and another. And this is a possibility which currently exists between several member states, but throughout the coming 2 years, all member states should come on board on that, on at least having this common exchange format. But also GDPR has been very crucial for us on the protection of data in general, but in particular for health data. Of course, there are also remaining issues when it comes to data needed for research, because yes, GDPR could be a little bit not clear on that sometimes, but we try to cope with that. And as you maybe have heard, the Commission finally published its proposal for the European Health Data Space 2 days ago. So that's the 3rd of May. And we are very excited about that. And of course, there are provisions on the exchange of secondary health data and then primary health data, and different steps to be taken in each member state also to allow for this exchange of health data to happen. That's in fact the first data space that has really been, let's say, put forward, because the Data Act that the Commission took 2 years ago envisions 9 different data spaces, but this one, the health data space, really is the first one that we are going to build in terms of infrastructure, but also in terms of policy, because this situation in which the health data exists all over, at least in the EU, scattered in various registries and health facilities, and not communicating together, has been a very big challenge, and also in particular in COVID, but we hope that we could now advance with that. Yeah.
Thank you, Irina. And let's make sure we have this latest document in the chat as well, and we'll get it around to everyone. We only have about 7 minutes or so left. Ian, you go ahead, and then I want to come back to Rich, and I want to make sure Sean tells us about predict and prevent, which has been referred to, but go ahead, Ian, couple minutes.
Yeah, thanks, Mike. I wanted to build on Yuka's comments about stakeholder engagement, but just before, to the points that both Yuka and Irina were making about health inequalities, as well as, of course, the life course approach for healthy aging, it's important within older people's groups that we also level up, because the disparities in experience and outcome in old age for health, independence and well-being are enormous. And our offer of enabling ICOPE implementation is to make that offer universal, to make it an offer suitable for low, middle and high resource countries, and within countries to make sure that groups who traditionally report less, but because of isolation or even because of gender, that women underreport compared to men, there's a huge challenge here to level up in global policy terms. And that's part of the stakeholder engagement work, I think, is we have to, as Yuka said, to engage at national levels with policymakers, engage with major providers. But the bit I wanted to talk about most was engaging locally, that there are often far more resources available locally to meet needs than we think. It's not all about putting people onto pathways so they get specialist interventions. partly it's that for people that are at risk, but a lot in my experience is about working with volunteers, working with family caregivers, working with care assistants. And really, if we regard these people and the community assets that are available and are able to mobilize these, we can have the most impact. And we can make sure that it's not just those who are lucky enough to be cared for by Dr. Hidenori Arai and his specialist center who get the platinum service, but we can extend that work and the principles of best practice to everywhere where older people have needs.
Well, that's so well said, Ian, and it's perhaps not surprising, therefore, that age-friendly communities is one of the centerpieces of the Decade of Healthy Aging. Rich, your comments, please.
Yeah, so we use technology throughout our medicine development process. So we use artificial intelligence and machine learning to machine-driven drug discovery. So that's actually the search for new molecules and new medicines. I touched on some of the clinical trial space and leveraging digital biomarkers to measure the effect of the medicines in the clinical process as we try and develop and speed those medications to patients. And then in the commercial side, we use a whole host of digital capabilities to support patients getting access to medications, to help manage adherence, to provide different information and knowledge back to their physician, because that stakeholder community that was mentioned earlier is we believe is critical. The ability to share insight back to all of the different stakeholders in that patient care journey is really important. So very briefly, that kind of touches on the end-to-end process of how we're applying digital technologies throughout the medicine development process, and then to support patients using those medications once they're diagnosed.
Well, thank you, Rich. It's very exciting. And of course, we know innovation is so critical. One of the ways we put it is that spending on health innovation should be seen as an investment in an era of longevity rather than a cost. We know that doesn't always work exactly that way, but certainly. Maybe I ask Sean to begin to bring it home here. We're almost at the end of the hour. Maybe Sean, a minute or so, and then, and I think the predict and prevent was already alluded to, and you've made some really incredible progress on that at Amgen and for the entire biomedical innovation world. And then if there's any last comment as we get to the top of the hour. Go ahead, Sean.
Thanks, Mike. I actually might use your point about investment as opposed to cost. When it comes to prevention, whether it be primary or secondary, is about early investments in an outcome that is going to happen or be prevented at some stage in the future. The downside, of course, is that we take a different approach to the numerator of the cost versus the denominator of the outcome. The ability to prevent outcomes over many years has to also be measured over many years, and both has financial and non-financial components. Financial being hospital offsets, for instance, non-financial being the ability to engage in a healthy life. So the concept of predict and prevent fits really well in that. I think for all of us who started off in a healthcare field, I was an exercise physiologist when I first left university, and that, to me, that was all about prevention, about maximising people's functional capacity and assisting them with outcomes. We've talked about today the ability to use data that sits either locally or within health data spaces to actually predict the people who might be on a particular course of an outcome and prevent or at least try to ameliorate those conditions before we get there. And that's more than just bone health, of course. That's many conditions that people might have as they age. And we need to look for particular points in time, both in phase, i.e. in the clinic or at the hospital, and out of phase. How do we give people information where they're at? Hidenori's example of the Kaionoba, where older people are getting together to talk to people, that becomes a space where people can talk about health as opposed to disease. So let's find those out of cycle opportunities as well to be able to help people think about their own ability to prevent functional decline, or more importantly, to maximize their functional outcome if we take a very positive psychological aspect to that. So there's certainly a lot that we can do within the decade to address both predicting those conditions and preventing them. Thank you, Mike, and thanks, colleagues.
Well, thank you, Sean. So we have barely a minute left. Any last comment in, a few seconds? Anything that anyone wants to leave everyone with, your last idea? Well, I think this is a great discussion. Let's look at it as just the start of this kind of discussion on the healthy aging ecosystem. And we've had an array of both public and private sector contributions to the last hour. At the end of the day, the stakeholder input, we talk about co-design, is so important. Maybe we're in a new world around that. How can digital help to collect that and reflect it in even the innovation process? Again, Yuka, as Yukasumi, Dr. Yukasumi is leading ICOPE for the WHO. We look forward to working with you and give you all the support we can. Thank you all for joining. I'd like to now call this session to a close. Again, suggest to everyone that they look for all of this on communications and live stream. And for those of you who are interested, there is a WHO session tomorrow, Friday, the last of the week of our older persons track at WSIS. So if there's no other comments, I want to thank everyone again. Rich Carter from Lilly, Nina from the EU, Dr. Ian Philp from Aged Care Technologies, Sean Libren from Amgen, Dr. Hidenori Arai from Japan and the National Group in Gerontology. Thank you very much, Dr. Arai, and Dr. Yukasumi at the World Health Organization and the ICOPE project. Thank you and goodbye, and enjoy the rest of your day or your evenings. Thank you.
Thank you.
Thanks for hosting,
Thank you,
Mike.
Mike. Thank you.
Bye. Bye-bye.